So I'm here with Julia Johnson, who's a speech therapist in Parkinson's. So Julia, I have some problems with my speech. I notice I speak quite softly and sometimes I fumble my words a bit. Are those things you see, and what other problems do you see with people with Parkinson's?
Yes, those are very typical symptoms of somebody with Parkinson's. Your speech is actually fantastic. So you're being sort of very specific, and that's what I like to see in somebody fairly newly diagnosed with Parkinson's, that they're being aware of any changes in their speech, because that's the important thing, is to note any changes and to try and work on them and control them, because we know it's a progressive illness, Parkinson's, and the onset of speech difficulties can be very slow. And in fact, reduced vocal loudness has been found to be present in up to 80% of people on diagnosis when they test you with special sound pressure level meters. And also in people before diagnosis. So they're now using apps to try and detect people with Parkinson's before diagnosis from elements such as their vocal loudness and voice quality, because it might be a precursor and an early onset symptom.
So I heard that in the prodromal stage, which is
that's right.
diagnosis. It can be very subtle speech changes that can indicate that you're going to get Parkinson's.
That's right, and that's typically at the vocal cord level. And the reason why they think that is that when they look down with the camera at the two little muscles in the throat, which are called the vocal cords, instead of coming together cleanly and vibrating, they vibrate with a slight, what they call glottal chink, so a little chink,
Okay.
and therefore the quality of the voice becomes a little bit breathy and the loudness becomes reduced.
Interesting.
And one of the other symptoms is often that the pitch range can shrink slightly. So instead of having 2 or 3 octaves from a low to a high note, the speech becomes more monotonous. So within maybe 1 octave of a pitch range. So when you're asking a question, you might not go up in pitch so much. And when you're saying a statement, you might not go down and be quite so emphatic with your lower pitch.
And of course, if you sing in a choir, you might notice that your range isn't as good as it used to be.
Absolutely. And singing in the choir, of course, a lot of people say to me, oh no, I've given up singing in the choir because I'm letting them down, I haven't got the vocal range. And my answer is always, you just hang on in there, you must stay singing in the choir, because that's the only way to combat this difficulty, is to keep that muscle exercised, that those precious little throat muscles, which people forget about. They think about exercising all the big muscles in their body, and they forget about my little voice muscles, which need just as much exercise as any other muscle in your body. And they will only get weaker and weaker if you don't exercise them.
So what you're saying is speech will gradually get worse in most cases. It's important to exercise the vocal cords to maintain your quality of speech. So what are some of the exercises you can do?
So one of the core exercises is to just keep those vocal cords on the running mill, or on the treadmill, like at the gym. So how you do that is you take a deep breath, you try and fill your lungs to the base of your lungs, and then prolong that voice. And keep it going for as long as you can. The goal is to try and get...
Try and annoy the neighbours.
Yes, try and annoy the neighbours. The goal is to try and get 15 seconds, but anything over 10 seconds is good. And also not to do it quietly, because you're not really exercising them. That would be like just walking along the road. In order to exercise, you have to maybe walk fast or maybe even run. So you have to do that exercise with volume. So not but so you can really feel those vocal cords working.
So what are some of in the later stages of Parkinson's, what are some of the other problems that can happen with speech?
So the other problems is that speech can start getting slightly faster. So they call it festination, or that's festination in your gait, but festination in speech might be referred to as palilalia. So as you try to talk, you get faster, and then as a result of that, you're stumbling over your words. So then the articulation starts breaking down. So the poor tongue and lips can't keep up with the speed that you're trying to speak at. And that's when the speech sounds a bit slurred.
So do I have to deliberately force myself to slow right down and articulate the words more eloquently?
Absolutely. Making sure that you're articulating every syllable within every word. So earlier on you said to me neurologist, and it was neurologist. It can slur because it's a multi-syllable word. So neurologist. So you're thinking about where you're stressing in that word. You're not going neurologist, you're saying neurologist. And you're making sure every sound and every syllable is emphasized, is articulated clearly.
So if I have Parkinson's and I don't have ready access to a speech therapist, what can I do? Where can I go to get help with this sort of thing?
Well, you should be able to access a speech and language therapist. I would always say everybody with Parkinson's on diagnosis should be offered a referral to speech and language therapy for advice and exercises. But there are also several of the websites which offer sheets and exercises. So, for example, Parkinson's UK, one of our excellent local Parkinson's charity in this country, has lots of ideas on how to help with communication difficulties. And so they will have some idea on exercises. But I would say the most important thing is to keep talking. Everybody, Bruce Forsyth in his heyday talked about keep dancing. A lot of people with Parkinson's start withdrawing from social situations because it's getting a bit difficult and they find breaking into conversations difficult. So their default is to maybe slightly withdraw and be the listener, which is lovely to have listeners in our midst, but I want with Parkinson's to be the talkers because it's the talking that's the exercise. The best exercise you can do is getting out socially, meeting up with friends, meeting up with family and talking. That's better than any, I hate to say it, speech therapy session, is to be remaining socially active and chatting.
Brilliant. Thank you very much. It's been a pleasure to talk to you. Thank you.
It's a pleasure.